May I come in?
Yeah.
Hi, how are you doing?
Good. How are you?
Good, thank you. My name is Kate. I'm a UMKC nursing student, and I'm going to be doing your head-to-toe assessment today. Can you go ahead and verify your name and date of birth for me?
Yeah. Michelle Liu, January 23rd, 2001.
Perfect. And then can you go ahead and tell me where you are right now?
UMKC School of Nursing.
Perfect. And what is today's date?
December 1st, 2020.
Good job. And do you have any allergies?
No.
Wonderful. Patient is alert and oriented ×3 in a calm, relaxed, content, and cooperative state. And so I'm going to go ahead and perform hand hygiene and put on gloves, and we'll get started, okay? All right, I'm going to move the camera. We're going to go ahead and start with the skin. So Michelle, if you would stand up for me and come stand over here. You want to stand over here and face this way. So looking at her skin just at a glance, we have an even coloration throughout the body, consistent with ethnicity. I'm going to start palpating now with the back of my hands for temperature. It's a nice warm temperature, all equal throughout, equal bilaterally. Skin is dry without excessive dryness or excessive moisture. I'm not noting any major lesions or bumps, no edema on the wrists or in the lower extremities, if you'll turn around for me. Same thing on the back, palpating all the way down, all the extremities, doing both upper and lower extremities. All right, temperature is warm, equal bilaterally, dry skin, good moisture without excessive moisture. No edema or anything like that. And then if you'll turn around for me, I'm going to go ahead and test skin turgor right here on the collarbone. And skin returned promptly, which means we have good skin turgor and our patient is hydrated. So you can go ahead and sit back down for me. And I'm going to go ahead and move on to inspect the head. So as I'm palpating around the head, her head is a normal cephalic shape. She has thick, black, straight hair. Her hair is evenly distributed. No baldings, no infestations of any kind. Beautiful hair. You can look up for me. You can take your face shield off for just a quick moment. I'm going to palpate those temporal arteries now. You would turn it this way. Thank you. Alrighty, temporal arteries are regular rhythm in 2+. And if you're going to pull your mask down this time, you can put your face shield back on if you'd like. Perfect, and I'm just going to reach around and palpate the temporomandibular joint. If you'll rotate today. Yep, thank you. You can go ahead and open and close your mouth. Good job, one more time. Any pain with that motion?
No.
Alright, smooth motion, no popping of any kind. And then go ahead, I'm going to test cranial nerve 5. Go ahead and open your mouth and use my hand. Good job. Now clench your jaw. Don't let me open. Good job. Cranial nerve 5 is intact. And now we're going to test cranial nerve 7. So will you give me a smile and a frown? And go ahead. Lift your eyebrows for me. Good job. Now close your eyes. Good job. Can you puff out your cheeks? Don't let me pop them. Good job. Cranial nerve number 7 is intact. So you put your mask back up. We're going to move on to the eyes real quick. So you can take that off so we can get a better look, and we'll put it right back on. All right, just looking at the external eyes, they are in line bilaterally. Hair is evenly distributed on the eyebrows and the eyelashes. We have an equal symmetrical shape of the eyes and the eyebrows. I'm going to have you look up for me. Looking at the conjunctiva, it is pinky red and moist. Sclera is white and moist. I'm going to palpate the lacrimal apparatus. Do you feel any pain? All right, sounds good. I'm going to come from the side and look at the irises and the corneas. Our irises are flat and round. Perfect. They are brown and homogeneous in color. Will you look up at the light for me? Corneal light reflex is present in both eyes. Our corneas are glossy and clear, non-opaque, and no abrasions noted. Now I'm going to go ahead and move on to look at our pupils. So first I'm just going to measure them. You look right at me. measuring out about 4 milliliters, or millimeters, in both eyes. And I'm going to go ahead and shine a light in now. Okay, so look right ahead at me. All right. They constricted down to about 3 millimeters. And I'm going to do accommodation. So like my finger's going to come in towards your nose. Good job. And pupils constrict accordingly. So perla is noted. Pupils are equally round and reactive to light and accommodation. Now I'm going to go ahead and test cranial nerve 2, which is the optic nerve. If you'll hold that and cover one eye for me. Can you read me the smallest line you can see?
Yeah, 428,739.
Alrighty, and can you switch and do the other one?
428,739.
Wonderful. And both eyes?
428,739.
Wonderful. 20/20 vision in our patient. Optic nerve, cranial nerve 2 is intact. And now we're going to do, you can turn this way a little bit. We're going to check cranial nerves 3, 4, and 6. So follow my finger. Good job. Cranial nerves 3, 4, and 6 are all intact. And I'm going to go ahead and move on to the nose. So you can pull your mask down a little bit. We're going to look at your nose. Looking up, our septum is midline, no deviations. Nasal mucosa is healthy, pink, and moist. No occlusions of any kind. And I'm going to check for patency. So I'm going to touch one nostril and take a deep breath. Good job. And again. Good job. Patency of the nose, the nares is noted and good. And we're going to go ahead and move on to the lips while her mask is already down. Lips are pink and moist and even in coloration, no sores or lesions of any kind. You can go ahead and smile for me. Look at the teeth, good job. Teeth are white and straight. Teeth and gums are flush with each other. Our gums are pink and moist. Can you open your mouth for me? Our buccal mucosa is also pink, moist, and healthy. I'm going to grab a tongue blade now. If you'll turn this way a little bit. I'm going to be checking for tonsils first. Can you say ah? Can you say it out for me a little bit more? There you go. All right, tonsils are rated a 1+. Can you say ah one more time? Good job. Cranial nerves 9 and 10 are intact. The uvula is midline and rises and falls with phonation. All right, can you stick your tongue out for me? Can you go side to side, up and down? Can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. Cranial nerve number 12 is also intact. You can put your mouth back out. And then, thank you. And then I'm going to go ahead and just look at your ears real quick. So as I'm looking at them, they are symmetric and even in line with each other bilaterally. Skin color is consistent with the rest of the face and head. I'm not noting any redness, dryness, or discharge or drainage. As I'm checking auditory meatus and pushing down, are you experiencing any pain?
No.
Okay. Any pain here?
Nope.
Good job. And now I'm going to do the whispered voice test. So I'm going to have you push up and down on your tragus like this, and I'm going to stand behind you and say a combination of 3 letters or numbers, okay?
Okay.
Starting with the left side.
A1C. A1C.
Good job. And the right side.
738.
Good job. Patient got 6 out of 6, and that concludes our ear examination. So we're going to go ahead and I'm going to move down to the neck now. Starting with the palpation of the lymph nodes. We're going to start with our pre-auricular, post-auricular behind the ear, occipital at the base of the skull, submental right here at the base of her chin, submandibular, jugulogastric, superficial cervical, posterior cervical. Deep cervical is normally not palpable, but is also in the neck, and supraclavicular. They are all non-palpable and discrete, which is normal, indicates that they are not currently fighting an infection. Additionally, I'm going to look at the thyroid, or the thymus. So we'll go ahead and swallow for me. Good job. Now I'm going to come behind you and do another swallow. Good job. Thyroid is non-palpable. Since not palpable. No nodules noted, not enlarged, which is normal. And then we're going to go ahead and test cranial nerve number 11, which is a spinal accessory. So go ahead and shrug your shoulders. Good job. And can you push your head that way? And the other way. Good job. Spinal nerve, or cranial nerve 11, which is spinal accessory, is intact. And that concludes the neck. So then we're going to move on and do lungs. So if you want to sit just facing forward so you can see your side and put your arms out. Just looking from the side at our configuration, we have an elliptical shape of the thorax. We have a 1-to-2 ratio, not noting any barrel chesting or any other thorax abnormalities. And then if you want to turn this way so they can see the back, I'm going to start with the posterior chest. Looking, her respirations are even in depth and rate. I'm going to start with doing testing her expansion. So I'm going to put my thumbs together at the back of her chest. Take a deep breath. Good job. We have symmetric chest expansion on the posterior chest. And now I'm going to start auscultating in a Z pattern for her lung sounds with the diaphragm of my stethoscope. Alrighty, so whenever you feel my stethoscope, just take a deep breath for me, okay?
Okay.
Deep breath. Lung sounds are clear and equal in all fields. No adventitious sounds are noted. Here we heard our bronchovesicular sounds, and here we heard our vesicular sounds in the periphery. And if you want to turn around, we'll go ahead and do the front of your chest as well. Same thing, I'm going to start with the chest expansion. So I'm putting my thumbs together. Take a deep breath. Good job. We have symmetric chest expansion here as well. And then I'm going to go ahead and auscultate with the diaphragm of my stethoscope for the lung breath sounds on the anterior chest. And maybe take a deep breath. One more. Good job. Lung sounds are clear and present and equal in all fields with no adventitious sounds. Here in the neck we heard our bronchial sounds. Here coming down her chest we heard the bronchiovesicular sounds. And we heard our vesicular sounds here in the periphery. And so now we're going to go ahead and move on to your heart and neck vessels. So first I'm going to palpate the carotid arteries one at a time. Alrighty, and the other one. Alright, carotid pulses are regular and a 2+, and while I'm here, I'm going to go ahead and use the bell of my stethoscope to auscultate for any bruits. And 3 places on each side. Take a deep breath and exhale and hold it. Alrighty, take a deep breath, hold it. Exhale. No carotid bruits are noted. And at this time, I'm going to go ahead and palpate her radial pulses for 30 seconds and figure out a rate. Start 30 seconds. Alright, we had a rate of 80 beats per minute on our left radial pulse. And I'm going to come over here and do the right radial pulse. Alright, I'm going to go ahead and start it right now. Alrighty, we got 80 beats per minute again in the right arm. And so now I'm going to go ahead and auscultate for murmurs in the aortic and pulmonic spaces using the diaphragm of my stethoscope. There we go. Can you go ahead and lean forward for me? Listening in the aortic space. And pulmonic. No murmurs noted, and so now I'm going to go ahead and point out the 5 heart sound areas and then auscultate them. Here we have our aortic, our pulmonic, our Erb's point, tricuspid, and our mitral. So first I'm going to auscultate those heart sounds with the diaphragm of my stethoscope. Aortic. Now we're doing pulmonic. Erb's point. Good. I'm going to come up here and do tricuspid. Awesome. And mitral over here. Alrighty. And here at the apex of the heart, S1 is loudest, and up here is the base of the heart where S2 is loudest. The base of the heart is about the second or third midclavicular line, second or third intercostal space at the midclavicular line, and the apex is going to be at the midclavicular line at the fifth or sixth intercostal space. And now I'm going to repeat that same method using the bell of my stethoscope to auscultate for any bruits. Aortic, going to pulmonic, Erb's point, tricuspid, and mitral. No bruits are noted on our patient, and so now I'm going to switch back to the diaphragm, and I'm going to auscultate the apical pulse and find out our rate. Starting. that time I got about 82 beats per minute on that one. And earlier when I did those radial pulses, I found that they were regular, equal bilaterally, and rated a 2+. And that is going to conclude our heart and neck vessel assessment. So you can go ahead and lay back, and we're going to do your abdomen next. All right, so I'm going to stand over here. First, I'm going to not touch the patient and just inspect. We have a flat contour. The skin is even in coloration with the rest of the body. Our umbilicus is midline and inverted. I don't see any pulsating or visible masses. So I'm going to go ahead and use the diaphragm of my stethoscope to auscultate for bowel sounds. Going from right lower quadrant to right upper, and left lower quadrant in that order for the whole assessment. All right, bowel sounds are present in all 4 quadrants, and now I'm going to switch to the bell of my stethoscope, and I'm going to auscultate for abdominal aortic and renal groove beats. No bruits are noted, and so now I'm going to move on to percuss the abdomen in that same order that I auscultated. General tympany is the predominant sound of the abdomen, and that was noted. Now I'm going to move on to a light palpation. Please let me know if you feel any tenderness or pain, okay? Any here? No. Here? No. Here? No. Perfect. No pain or tenderness noted. No palpable masses or lumps noted either. We're going to move on to a deep palpation. Same thing. If you feel any pain or tenderness, let me know. No. No. Nope. Alrighty. No pain or tenderness noted, as well as no palpable lumps or masses. Now I'm going to go ahead and try to palpate the liver. Go ahead and take a deep breath. And exhale. Liver is not palpable, which is normal. I'm going to try to do the same thing with the spleen on the left side. Go ahead and take a deep breath. And exhale. The spleen is also not palpable, indicating that it is not enlarged in any way. I'm going to now use the duckbill method to try to palpate the kidney. Left kidney is not palpable. And the right kidney is not palpable, and that is both normal for not kidneys to be palpable. So we're all done with abdomen. Now you can go ahead and sit up. And I'm going to move down here before we stand up, and I'm going to check out your lower extremities. We already checked for edema, which there is none, and we already checked the temperature and texture of your skin when we did the skin assessment. So right now, there we go. Oh, just kidding. It doesn't want to focus. There we go. I'm going to go ahead and palpate your posterior tibial artery, or your posterior tibial pulse. Alrighty, posterior tibial pulse on the left is regular and a 2+, and I'm going to do the right now. Rhythm is regular on the right side as well, and a 2+. Strength, and I'm going to do the dorsalis pedis pulse on the right foot first. All right, and that one is regular and 2+. Alrighty, and the left dorsalis pedis is also regular and a 2+. So if you want to go ahead and stand up with me, we're going to do your musculoskeletal assessment. So just follow along with what I do. We're going to start with your spine, so if you'll go ahead and touch your toes and scoot up for me a little bit, sorry. Spine is midline and straight. Go ahead, stand up. Continue twist. Good job. And lean side to side for me. Good job. Our spinal range of motion is full. We have a full range of motion with smooth movements, no crepitus of any kind. We're going to move on and just do some more shoulders. So follow me up all the way and behind. Good job. And up. Down. Can you push back? And can you cross behind your back? Good job. Can you lift your arms out for me? Try to push against me. Good job. We have a full range of motion in our shoulders with smooth motion and great our shoulder strength as well. Now with our elbows, can you just bend and straighten for me? Good job. And now pull up against me and push. Good job. Full range of motion in the elbows and great strength. And for wrists, will you flip them and then circles and reverse it? Good job. Go ahead and push against my hands. Good job. And flip them down. Push against again. Good job. Full range of motion in the wrists and no crepitus, smooth motions, and great strength. Now go ahead and touch fingertips. Range of motion of fingers, and we grip my fingers. And great grip strength as well. We're going to go ahead and move to the lower extremity, so you can grab a wall if you need. And we're going to do hips first. So lift your hip up and out and in, and do a full circle, and go back the other way. Perfect. Lift that leg up for me and push in towards my hand. Good job. And push out. Great job. And let's do the other hip. Same thing, up, out, in, and a full circle. And let's do a circle the other way. And then testing strength on the hip again. Push out. Good job. And in. Great job. Hips have a full range of motion. No crepitus of any kind, no rigid motions, and great strength. Now for our knees, we're just going to flex and extend, bend and straighten. Good job. Now push against my hand. Great. Now pull. Good job. And other knee. Good job. Go ahead and push. Pull. Great job. Now go ahead and flex and point your toes for me. There you go. Can you roll your ankle in a circle? Great job. Go ahead and push on my hand and lift. And push on my hand and lift. Great job. Our lower extremities have a full range of motion and great muscular strength as well. While we're standing, I'm going to go ahead and test your cerebellar function. So go ahead and let's do some rapid alternating movements. You're going to pat your thighs and switch and get faster if you can. Good job. Great. Now can you close your eyes and touch finger to nose for me? Through your shield. Great. There you go, if you can. Great job. And then can you close your eyes and touch your heel down your shin for me? Great job. And other foot. Good job. Cerebellar function of our upper and lower extremities is intact. And also while we're standing, we're going to go ahead and do a Romberg test. So I'm going to have you stand this way for me with your arms out and close your eyes. And I'm going to start 20 seconds and make sure that my patient is not swaying. And I have my arms here to catch her if she does sway or fall. Alrighty, you're done. We have a negative Romberg sign. You can go ahead and take a seat. Next, I'm going to go ahead and test your light sensation. So I'm going to use this cotton swab. You go ahead and close your eyes and just say when you feel the sensation, okay? Do you feel it?
No. Oh, the mask is confusing.
Oh, sorry. Here, we'll go.
Oh, yeah, now. 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 Now.
Alrighty, light sensation and neurologic system is intact. And to run that side, I'm going to go ahead and test your deep tendon reflexes. So I'm going to start with your biceps reflex. So just relax your arm for me. biceps reflexes are present in both arms and 2+. So now I'm going to move to the triceps. Perfect. That one was great. Move this over here. Relax your arm. There we go. Thank you. And we'll do, and then both triceps reflexes were present and rated 2+. So relax your arm down here. There we are. Here we go. Almost. Alrighty. Brachioradialis reflexes are both present in each arm. They are present in each arm and graded a 2+. Now moving on to the lower extremities. Whoa. Wow, that one was hyper. There we go. Wow, good job. Both patellar reflexes are present and strong, rated a 2+ because they're not exactly hyper, they're just strong. And then lastly, Achilles. So go ahead and relax your leg for me. Alrighty. And both Achilles reflexes are as present as well and rated 2+. Alrighty, and that's going to conclude our assessment today. So thank you very much and have a great day.
You too. Thank you.